Hello and welcome. Today we're diving into the world of urinary system diseases, focusing specifically on urethritis. What is urethritis and how does it affect the body? Let's explore this common condition. Urethritis, at its core, is an inflammation of the urethra, the tube that carries urine from the bladder to the outside of the body. But what causes this inflammation? The most frequent culprits are bacterial infections. Sexually transmitted infections or STIs like gonorrhea and chlamydia are prominent causes. However, urethritis can also stem from non-STI related bacteria, such as E. coli, and sometimes even from viruses or fungi. Irritation from chemical irritants, like certain soaps or spermicides, or even injury can also lead to urethritis, although these are less common. Now, let's delve into the pathophysiology. When infectious agents or irritants invade the urethra, they trigger an inflammatory response. This response involves the release of inflammatory mediators, which leads to swelling, redness, and irritation of the urethral lining. This inflammation disrupts the normal function of the urethra, making urination painful and sometimes causing discharge. In untreated cases, the inflammation can spread to nearby structures, leading to further complications. Urethritis is a fairly common condition, especially among sexually active individuals. The incidence varies depending on factors like age, sexual behavior, and access to healthcare. STIs are a major driver of urethritis cases globally. It's important to remember that both men and women can be affected, but the symptoms and complications can differ. So, how does urethritis present itself? Common signs and symptoms include a burning sensation during urination, frequent or urgent need to urinate, discharge from the urethra which can be clear, cloudy, or yellowish, itching or irritation at the urethral opening, and sometimes pain during sexual intercourse. In some cases, individuals, particularly women, may experience only mild symptoms or no symptoms at all, making diagnosis more challenging. Diagnosing urethritis typically involves a physical examination, a review of the patient's medical history and sexual history, and laboratory tests. A urine sample is collected to detect the presence of bacteria or other infectious agents. A urethral swab may also be taken, especially in men, to identify specific pathogens like gonorrhea or chlamydia. Testing for other STIs is also commonly recommended to rule out co-infections. Urethritis can be broadly classified into two main categories: gonococcal urethritis and nonococcal urethritis (NGU). Gonococcal urethritis is caused by the bacterium Neisseria gonorrhoeae, while NGU encompasses urethritis caused by other pathogens, the most common being Chlamydia trachomatis. Identifying the specific type of urethritis is crucial for determining the appropriate treatment strategy. The primary treatment for urethritis is antibiotics. The specific antibiotic prescribed depends on the identified cause of the infection. For gonococcal urethritis, antibiotics effective against Neisseria gonorrhoeae are used. For non-gonococcal urethritis, antibiotics effective against chlamydia and other common bacteria are prescribed. It's vital to complete the entire course of antibiotics as prescribed, even if symptoms improve, to ensure complete eradication of the infection. Sexual partners should also be treated to prevent reinfection. Over-the-counter pain relievers can help manage the discomfort associated with urethritis. Additionally, avoiding irritants like scented soaps and spermicides can aid in recovery. Prevention is key when it comes to urethritis. Practicing safe sex, including using condoms consistently and correctly, significantly reduces the risk of contracting STIs that can cause urethritis. Regular STI screening, especially for sexually active individuals with multiple partners, is also essential. Avoiding potential irritants and maintaining good hygiene can further minimize the risk. Open communication with sexual partners about sexual health and STI testing is crucial for preventing the spread of infection. The prognosis for urethritis is generally excellent with prompt and appropriate treatment. Antibiotics are usually highly effective in eradicating the infection. However, untreated urethritis can lead to complications, such as the spread of infection to other parts of the reproductive system, potentially causing pelvic inflammatory disease in women and epididymitis in men. Recent research is focusing on developing more effective and faster-acting antibiotics to combat drug-resistant strains of bacteria that can cause urethritis. There is also ongoing research into improved diagnostic methods for quicker and more accurate identification of the specific pathogens involved, leading to more targeted treatment approaches.